Hello everyone, this is Khalil, and I am presenting our abstract entitled Factors Associated with Postoperative Complications of Early and Late Discharge of Patients Undergoing Surgery for Pelvic Organ Prolapse, a National Database Study. I have no disclosures. So as an introduction, it has been shown that outpatient surgery has some advantages over inpatient surgery, such as easier in-home recovery time, reduced stress, predictable scheduling, and lower healthcare costs. And contemporary reports on perioperative morbidity of outpatient versus inpatient pelvic organ prolapse surgeries are scarce. So we aim to compare 30-day postoperative complications between early or less than 24 hours versus late discharge following colporrhaphy, and also to determine the factors associated with early postoperative complications following colporrhaphy. So what we did is that we used the National Surgical Quality Improvement Program, or NSQIP database, to identify female patients receiving colporrhaphy either anterior, posterior, or combined, with same-day hospital discharge as an outpatient group, or those who discharged after more than 1 day as an inpatient group. We recorded patient characteristics, preoperative labs, ASA class, and 30-day complications. Also, multivariable logistic regressions were performed to determine factors associated with increased risk of postoperative complications following colporrhaphy. We identified about 11,600 females receiving colporrhaphy, from which 32% were in outpatient group and 68% were in inpatient group. We observed that patients in an inpatient group were older, sicker, had higher body mass index, more likely to be current smokers, and required longer operating time than those in outpatient group. Mean length of stay in inpatient group was approximately 2.5 days. Mean operating time was significantly shorter in outpatient versus inpatient group. Additionally, the overall 30-day complications, reoperation, and readmission were significantly lower in outpatient versus inpatient group. We identified factors that were independently associated with higher risk of early postoperative complications in both groups, and they were white race, ASA class 3 versus 1 or 2, abnormal preoperative white cell count, and longer operating time with 10-minute increment. So in conclusion, outpatient colporrhaphy group was associated with lower 30-day morbidity compared to inpatient group, and generally, white race, higher ASA class, abnormal white blood cell count, and longer operating time were associated with higher risk of early postoperative complications following colporrhaphy. To confirm our observations, cooperative prospective studies are warranted. Thank you for your listening.